you see, today there are more ways than ever to fix teeth and improve your smile, from changing the color to straightening to downright replacing teeth. Cosmetic dentistry provides a lot of options. Please welcome cosmetic dentist Dr. Karan Wade back to the show. All right, Karan, we have somebody who has a question for you. We have Trisha on the phone line right now. Good morning, Trisha.
Good morning.
What's your question?
Well, I've got 2 crowns.
Okay.
I have had 2 crowns, a number 3 and a number 30. And I since then, I've not been able to eat on that side at all. And I'm told that I'm probably going to have a root canal on my up and bottom. My question is how is there a way I can find out if both of those are going to have root canals, or am I going to, is there something I can do? Because, root canals are not easy to go through. Is it things happened a little bit easier today to make it better for me, so I don't have to, go?
It is easier today. At least mine were. So
yeah,
okay,
it's easier today to get a root canal. But as far as her crowns are concerned, what's bothering her? It's really hard to tell without actually seeing her or having her come into the office. But she probably needs to get an X-ray of both the teeth. And as she goes to see her dentist, they can disseminate which tooth is actually hurting her and which one it might not be. She could sometimes be having referred pain. It could be one tooth, and she's thinking it's another tooth. Just because the way the nerves run, she could be getting referred pain.
And sometimes those crowns can become loose, right? And stuff can get up underneath it.
Sometimes they can come loose. Sometimes things can get up under them. But she would just actually need to go in and be X-rayed and have the dentist determine which tooth it actually is. She may or may not have to have root canals in both of them.
And don't be afraid of root canals. I was impressed that she knew which numbers they were. Like my mouth. Okay, that's all I know. All right, we talked about in terms of cosmetic dentistry, there's so much more we can do today than ever before. We're going to talk about a number of the things, and one of them, of course, is bleaching. And you mentioned there are the home bleaching kits, but the things you get in the dentist office are just going to be more effective.
The bleaching gel that you get at the dental office is a little bit stronger than what you can buy over the counter. And it actually, what happens when you bleach your teeth have what we call dental tubules. Just like you have pores in your skin, you have dental tubules in your teeth. And the bleaching gel actually opens up the dental tubules. The bleaching gel gets down into the dental tubules, and it actually gets the staining, the coffee, the tea, the juice, whatever you're drinking.
Everything you had your whole life. In fact, Rose is with us. She's one of your patients. And Rose, what was it about your teeth and your smile that you didn't like?
In the beginning, I really didn't like anything, but I also work for it, so it's one of those things where everything I see, when I see something new come down, I want to get it.
Right.
So I did the Invisalign. I'm in the Invisalign. I do the bleaching.
Right.
I was the
Let's back up. You said Invisalign. For people who don't know what that is, Invisalign is kind of a form of braces, if you will.
Absolutely.
But the thing is, Invisa, that key word there, smile for us real big. You can't see them because it's a clear tray that actually fits over your teeth.
Right. They're aligners. They're called aligners, and you get so many aligners depending on how much movement that your teeth need to have done. And you'll change your aligners out every 2 weeks, and at the end of X number of days, not X number of days, months. X number of months, rather, your teeth will be voila, they'll be beautiful.
Because I've done the Invisalign, and what's really cool about it is that, again, you don't see it.
Absolutely.
And I didn't think at first that little clear tray could actually shift teeth, but it does.
It actually does. It's all done by computer.
Yeah, very cool, because the computer can tell you exactly which teeth need to be shifted.
Exactly.
And how that tray needs to look. All right. You also have in the audience one of your other patients, Laquita. I'm sorry, Laquita. And Laquita, you had the Invisalign as well. And what else did you have as a concern for you?
I actually still have the Invisalign. I'm in the process. But I had crowding from wisdom teeth coming out. So it's definitely improved. And I work in the public, so it's really important for me to have a nice smile.
And that's the other thing, is a lot of people a little bit older, out of our teen years, are wanting to get our teeth straightened, but we're thinking, can I really show up with a mouthful of metal?
Absolutely. A lot of patients who, especially patients who deal with the public, as yourself, or people who, just are out there in corporations, and they don't want to have a mouth full of metal.
Now, is Invisalign as effective as the traditional braces?
Absolutely. Actually, in some cases, the Invisalign will move the teeth quicker than the traditional braces.
All right. You have Vanessa with us. Hi, Vanessa. Your teeth look beautiful. What did you do?
I had braces on for 2 years.
Yeah. Well, it's acceptable for like you because you're so young.
Vanessa had the regular traditional braces.
But having those regular traditional braces, can you tell me the difference in how you feel in smiling now, what your teeth look like before?
It feels funny. Like, I got used to them, so it feels funny now. I'm barely getting used to my regular teeth again.
But when you look into the mirror, what do you like?
I'm like, wow, my teeth are straight.
Yeah. All right, and then also we have Richard. And Richard, this is how far we've come. I mean, you can certainly do things like straighten your teeth, but then you can downright replace teeth. And Richard, what was your situation?
Well, when I saw Dr. Wade, I had dentures, and I was really miserable with them because you have to put adhesive in your mouth to make them stay.
Right.
And by the end of the day, it's horrible. The dentures she replaced for me are called ultra suction. They actually cling into my mouth. They develop suction over a period of time, and I just put them in my mouth. Plus, over a period of time, as the suction gets better, she's actually able to make my upper plate smaller, so I can enjoy the taste of food much more, and I can go out and eat. I went through a whole year where I didn't even go out to eat because it was just miserable for me to do it.
Can you smile for me? Look at that. Beautiful. Look at beautiful teeth. Those are all dentures. That's amazing. That's amazing. Okay, there's that. There's veneers. There's just all kinds of things that people can do. So whatever your issue is, the first thing you do, go in, and then you can assess what types of treatment that they might need.
Absolutely, absolutely, Deborah.
All right, Dr. Wade, thank you very much.
Thank
For
you.
more information, you can contact Dr. Karan Wade at 713-654-7755. Is that 56? 56. I need the eye doctor. All right. Or you can log on to kwwadedds.com.